Healthcare reform is one of those things that has a lot of our clients concerned, but the reality is at this point, there's really not too many things that they need to be concerned about. To date, all of the healthcare reform items that are going to be implemented have already been implemented, like the age 26 for dependents, the preventative care, the consumer protections, the minimum loss ratios. Over the next couple of years, there aren't a whole lot of items that are really going to impact the employee groups, with the exception of reporting on W-2s, company-provided health care. So what's gonna happen down the road? Well, that is probably the $64,000 question. In reality, I think even if you ask the experts in the legal community, they can't answer that, only with their best guess maybe, because there's a lot of legal challenges ahead for healthcare reform. And most likely the Florida case, where 26 states have basically sued against the constitutionality of healthcare reform, will be heard by the Supreme Court in 2012. So what should a company do at this point to make sure that they are in compliance with federal and state laws? In reality, they need to go back and they need to look at their documents that they have that support their employee benefits. You know, how do they handle their COBRA? How are they handling their cafeteria plans? What do their summary plan descriptions say? And if they haven't looked at those documents in the last couple of years, now would be a very good time for them to take a look at it. In reality, being in compliance with federal and state law is pretty easy to do, even if you're not current with what you have. It's a lot harder to do if the Department of Labor or the IRS has come into your office to look at your documents and found that you're not in compliance. So I would recommend working with a firm that works with attorneys that specialize in employment and benefit law.